Hi, welcome to Global Village TV. At Global Village TV, we discuss or engage in conversation over some of the common issues that affect us and our common planet. Today, we are going to talk about health education made easy. The program for today is Health Education Made Easy. And the main theme for today will be about high blood pressure. I'll try to explain everything in a language that a lay person can understand. Before I continue, I want to issue a disclaimer. This program is free and I'm making use of the latest scientific knowledge on the theme. But I'm not responsible for anything. I'm not your doctor. So if you have any questions or doubts, you can contact your own GP. So don't bring me to court to litigate and say, I heard the doctor say this and that. I want to introduce myself. My name is Dr. Peprah-Gyamfi. I am a medical doctor, author, evangelist, human rights activists. So, to the theme of high blood pressure, I want to explain the three words: high, blood, and pressure. High is something that is extreme, above the normal value. Blood is the red fluid or liquid that circulates around our body to transport nutrients and oxygen to the cells. To be able to do so, the body needs, there should be pressure. There should be a pressure that pumps the blood around. And the function is taken over by a pump, the heart. The heart pumps the blood around the body. And to be able to pump, it needs pressure. A certain degree of pressure is needed. Too high is not good, too low is not good. So there should be an ideal blood pressure. So what is an ideal blood pressure? Okay, it's usually a range is what is used. There are two values. You call the upper part called systolic, the lower one is diastolic. I don't want to be going to the complexities, but usually the standard or the ideal blood pressure is 120/80. That is the ideal. But any value that ranges between 90 to 60, and then 140 to 90. 90 to 60, the lower part. 140 to 90 is the range is satisfactory or acceptable. As I said, the ideal is 120 to 80. It is when it goes very high. For example, there have been cases or instances during my medical practice that I've measured pressure of 230 to 150. And that is a pressure that is very extremely high. In that particular instance, I had to refer the patient to the accident and emergency or A&E because it's a medical emergency, because if nothing is done, it could lead to complications. And one of the complications could be either stroke or heart attack. So I hope I'm clear so far. So what are the symptoms? Somebody will ask me, a layman will say, so how do I know I have high blood pressure? So today we are all talking about COVID-19. So that is what everybody's talking about. But COVID-19 will pass away in 1 or 2 years, but high blood pressure will stay with us. And it is also sometimes called a silent killer because you will not know that you have it unless you measure your pressure. Unless you measure it, you don't know. So sometimes it comes too late. And when it's too late, before you know, you have got maybe a stroke, which may even then end in death. But generally, you say that some of the symptoms are persistent headache. I'm not saying that every headache is high blood pressure, but if you have a headache which persists for a long time or for a while, it's very important to check your blood pressure pressure to see whether it could be due to the high blood pressure is causing the headache. And if all of a sudden you live with somebody and you go home, you go out and you come and see the person in a state of confusion, it's possible that maybe the pressure is high. So these are some of the symptoms: headaches, confusion, and in the extreme case, the person may be fall in a coma. So I've talked about the symptoms. So the next issue to consider is what causes it. What causes high blood pressure? Medical science tells us that in about 90% of the cases, there is no cause. We call it primary hypertension. So 90% of the cases, approximately, you cannot find any cause. And in 10% of the cases, there is an underlying cause. Like, for example, if there's a kidney problem, a kidney disease, or a disease affecting the vessels supplying the kidney. I don't want to be very complex here, but a kidney problem can lead to high blood pressure. So if the doctors solve the kidney problem, then the pressure will resolve. Or there's some chemicals in the body called hormones. And some hormone problems can also lead to the high blood pressure. And then chronic alcoholism, people who drink a lot can also get high blood pressure. So if that person stops drinking, then the pressure could resolve. So that is only the 10% of the cases, as I said. But in the 90% of the cases, there are no causes. So in that case, in those 90% of the cases, there are some risk factors that have been identified. There have been risk factors that have been identified. One of the main risk factor is genetic. So if, for example, I want to explain it in a layman's language or a layperson's language. If your mother has a high blood pressure, then there's a possibility that you also get it. It will pass on to you. And if your mother and your father, both of them are affected, then your risk is even increased. So it could be then, as I said, if genetic, inherited, not directly inherited, but because your parents have it, they pass it on to you. Not through direct genetic inheritance. I don't want to become complex here. Then people who are overweight have the tendency to develop high blood pressure. And those who don't exercise enough, it can also lead to high blood pressure. Those alcohol can also lead to high blood pressure, chronic alcoholism. So these are some of the risk factors, as I've mentioned. And also, people who eat a lot of salt, increased salt intake can also increase your risk of high blood pressure. But the most important points here are that if your parents have pressure, and it's likely they will pass it on to you. You are overweight, and that can lead to high blood pressure. I hope you are getting you are following what I'm trying to explain to you. So, having talked about the risk factors, you go on to consider the complications. So what happens if you live with high blood pressure for a long time? Some of the complications is that it could lead to stroke. Stroke is a situation where there's something happens, like the vessels, because of the pressure is very high, some of the vessels or the arteries supplying the brain can rupture, and then there will be blood in the flow of blood in your brain, and that is what is called stroke. So that is one of the complications. And because the pressure is so high, because the heart is pumping against such a high pressure system in the body system, it can also lead to heart attack. So, and the high blood pressure, if it stays for a long time, it's not controlled, it can also lead to eye problems. So if I have high blood pressure, what can I do to mitigate the matter? What can I do? So there are two issues to consider. I will tackle the first one. It's change of lifestyle. I mentioned some of the risk factors. Of course, as far as your parents are concerned, you can't change it. So if you are born with it, then, but you can do certain things to minimize the risk. For example, if you are obese or you are overweight, the reduction of your weight. I've seen cases where people have lost weight through weight reduction. They got their blood pressure normalized. And the change of lifestyle, as I said, people who are not active, so we can do exercises. Exercises have so many other positive effects. It will reduce your weight and also help to reduce your blood pressure. So these are, if you are a smoker, because smoking can increase your risk. So if you stop smoking, it will also help it. As you mentioned earlier about alcohol, you spoke about alcohol. So if you're an alcoholic and you stop drinking, it also has a positive effect on your pressure. And what I forgot to mention is also stress. Stress is one of the risk factors for getting high blood pressure. People who live under much of stress and sleep disturbance, stress can lead to disturbance of your sleep, anxiety, and all these things will have negative effects. But the moment you reduce your stress, then the risk factor is also reduced. Finally, your doctor will decide to prescribe medications. If after all that I've spoken about, your pressure is still high, then your doctor will prescribe medication. There are different types of medications, about 3 or 4, 5 different classes of medication. I don't want to go into the details, but usually we start with one type of medication and the smallest possible dose, then it will be increased gradually. And then if that one medication is not enough, the doctor will will add a second one. I've known cases where people are taking 4 different tablets to control their pressure. So then that is where your doctor comes in. And then a time will come, I've seen a lot of cases when patients come to you and say, "Doctor, our pressure has now become normal. Can you stop taking the medication?" The answer is a big no. You don't have to stop taking the medication, because it was because you are taking the medication that has brought your pressure down. If you stop taking it, there will be a rebound or a bounce reaction, and it will increase even the pressure more. So don't stop taking the medication on your own. But if actually it comes down, your doctor may decide to gradually reduce the medication. So if you're on 3 different medications, maybe you reduce it to 2, and then to 1, and then even the 1, he won't stop it completely, but you reduce it gradually to a point when he will decide to stop it. But even after that, you have to be monitored for a while. So that is as far as the medication is concerned. So the important thing is that you usually say that after the age of about 40 years, it's advisable that you check your pressure. If you have the means, you can buy some of these electronic blood pressure machines. So whether it's your family or not, at the age of 40, you try at least once or twice or 3 times a year, you have to check your pressure. If it's normal, okay, maybe it can be once a year. I know that I was growing up in a small village, and I just say to myself, because you don't have all the facilities to check pressure there, so that is a big issue. But so long as you are living in a place where you have all the opportunities to check your pressure, then I advise that you check it regularly. So I hope you got the message, and that you followed it well, and that it has become useful to you. If there are any questions, I have my email address on the screen, and also my website. You can contact me for further explanations. Thank you very much for your time.